Hi viewers, welcome back. In today's video we are going to discuss about sinusitis. Okay, so sinusitis, you would have heard of people saying pain in the forehead, pain in the maxillary region, pain in the mandibular region, all these areas. Many people, they complain that there is a pain and tenderness which is present in the face when they follow, that is rhinitis. There is an episode of sinusitis also. Okay, so this is a very common problem which many people face. Okay, so today we will discuss about this sinusitis in detail. Okay, so what is the definition for sinusitis? Okay, so when there is inflammation of your sinuses, at that time you term it as sinusitis. Okay, so you know the different areas where sinuses are located, your frontal sinus, maxillary sinus, mandibular sinus, all these areas when it is getting infected. So when there is a block in these draining areas, you know all these sinus, they have to drain. In case when there is a block in this particular region, so what happens? It gets blocked and it gets inflamed in that area. So when there is an inflammation of these sinuses, we term it as sinusitis. Okay, so the causative organism, we commonly have three causative organisms for sinusitis. One is Streptococcus pneumonia, then Moraxicella, and then we have Haemophilus influenza. These are the common microorganism which is causing sinusitis. Okay, so now there are other factors which can also cause sinusitis. That is, sometimes when there is a nasal septal deviation. So that is like when you are like going to palpate your nasal bone. So at that time you will not have a straight bone. Okay, you come, sometimes there is a deviation, then you will come back. So that is your nasal septal deviation. So when there is a deviation, this drainage doesn't take place properly. So at that time there will be a sinusitis problem occurring, and sometimes it is because of nasal polyps. So what is polyps? It is nothing but a growth in the nasal region. Okay, so internal nates, when there is a growth, maybe it is a malignant growth, sometimes it is a cancerous growth. These polyps, sometimes it is because of like frequent exposure to infection. When you get frequent rhinitis, when you get frequent cold, at that time what happens? All these sinuses which are present, they get inflamed every now and then. Because of that, there can be polyps formation. Okay, so in these reasons also there may be a sinusitis present. So usually when you get recurrent cold, when you take head bath, you don't drain the water properly when it is not getting dried up. So when you put up your hair with wet hair, at that time it happens. When you are getting exposed to cold climate, that is like when you are going to a cold place, and when you are getting all these sinuses, they go and get blocked. So all these causes, they can contribute to sinusitis. And then we have the etiological factors. So already now we have discussed the etiological factors and pathophysiology. So pathophysiology is like the entry of microorganism or exposure to a common cold. So what happens? There is an inflammation. So when there is an inflammation, what happens? There is a blockage or decongestion which is taking place, which is not allowing the sinuses to drain. So what happens? Because of the antibody antigen reaction or the body's defense mechanism, what happens? There is an inflammation process. So at that time there is decongestion. As these inflammations are beginning, there is severe congestion in these areas, which is going to cause pain in this particular region. Okay, so when you are coming to pathophysiology, then comes the signs and symptoms. So when you are having inflammation in these areas, so what happens? There will be pain in this area. Okay, pain will be present. Tenderness. What is pain? Pain is the patient reporting that there is an pain. Tenderness is like when you just touch this area, when you just compress this area, there will be pain. So that is called as your tenderness. Okay, so when you are compressing the maxillary sinus, at that time when you are having pain, when you have the frontal bones, when you are compressing these frontal bones, at that time there will be pain. So these type of pain and tenderness when it is present, when there is a running nose, when there is a congestion, nasal block when it is present, all these times you are going to have a sinusitis. Okay, so when there is sinusitis, patient may present with any of these conditions. Sometimes because of this blockage of the nose and the sinus area, what happens, there will be breathing difficulty. Sometimes there is a throat pain also taking place. So these are with your signs and symptoms of sinusitis, and then we have the treatment module. So treatment module, I always say, never go in for medical management immediately. Don't go and start with your drugs as soon as you rule out something which is present. It is always your body going to be your first warrior. They are going to fight with the microorganism. They will take all the actions which is needed. You are just going to help your body to do all these actions. So what you have to do is like home management. Always follow your home management. In case if your home managements are not effective, then you can go in for medical management. So home management, now what you do with for sinusitis, so always whenever there is a complaint of sinusitis, you have to go in for a head shower. So that is like warm head shower, which is very helpful in opening all your sinuses, and go in for steam inhalation. Okay, so like you take steam, so what happens, there is all dilatation of all your sinuses, which is going to open up all the sinus and everything will drain out. And so hot and moist packs, maybe like your hot applications, hot water bags you can use, and you can keep it over the area where you are having pain. Sometimes you can go in for hot compress. Okay, you know, hot compress, you can have a ball of rice in a white towel closed, and nicely you can give a compression, very effective to drain the secretions. And then your steam inhalation, I said, like either you can do it with the steam inhaler or directly you can do it on a stove. Okay, now on your gas only, like you can just have a vessel boiling water with little turmeric powder and rock salt you can add. You can take nice steam inhalation which will open all your sinuses. Okay, very effective. Then I said, like your hot showers and steam bath, if it is possible for you to take a steam bath, well and good, you can take a steam bath. Then inhaling moist steams, that is like I said, when you are taking steam inhalation, I said no, your turmeric and rock salt, so you can use your like tulsi and your karpuravalli, and there are many home remedy leaves, or like your naturally available products like your camphor and all these things. They are going to be very effective in opening all your sinuses. So these inhalers you can use. Okay, not the chemical inhalers, it is only your medicinal value plants and herbs and shrubs you can use. And then your balanced diet, so always you concentrate on your diet. It is going to be a very simple, easily digestible diet. More preferably take curd or buttermilk, curd rice, very soothing, which is going to improve your immune system. Try to take buttermilk. Sometimes like it is very soothing, and it will help you in like that digestion process. It is helpful, so that like healing takes place very fast. And you can go in with your vitamin C foods, that is like you can go in for citric juices, your orange juice, lemon juice and all those things, like it is going to help you out. But I always suggest personally, like whenever you are having a congestion, at that time try to avoid all these things. The other areas, the other time concentrate on vitamin C foods, like which is going to give you more immunity and which is going to stop you from getting infection only. Once you start with your high intake of vitamin C, you will not get exposed with cold and all these, like your respiratory infections very less when you have a higher amount of immunity level. Okay, so try to boost your immunity in the previous period. Okay, try to take probiotics. Okay, prebiotics, all these things are very effective in decreasing your episodes of your infections. And then we have adequate rest, provide adequate rest for the body. Okay, so no screens. Okay, either your mobile or TV or whatever it is, no screens. Always tell the child or the adult they have to take an adequate rest. Okay, tell them they have to sleep. Provide the body adequate rest, whatever it needs. Usually when you are giving more activity to your body, it becomes tired and your healing process will get delayed. Then try avoiding milk products. Okay, it is always a rule, like milk products, they cause congestions. Okay, when there is a chest congestion and sometimes when there is a nasal block and these sinusitis, when there is a block, what happens, there is a congestion. So at that time when you consume milk and milk products, what is going to happen, it is going to improve, that is like it is going to increase the congestion level. So try to avoid these milk and milk products during this episodes of your cold. So whatever it is, all your respiratory infections, you will try to avoid milk and milk products. In case, definitely if you want to give, you can add little turmeric and then you can give warm milk in case if you want to give. Otherwise, like milk products, you will try to avoid. So that is with the home management. So when your home managements are not successful, if you are not able to cure the condition with your home management, then you go in for medical management. So medical management, you know, like when there is an increased temperature, you will go in for antipyretics. When there is severe body pain, you have to go in for analgesics. And when there is an infection, so when the drainage is like little yellow in color, it is very thick, purulent smell, and like like when you feel it is infected, so at that time you can go in with your antibiotics. So these are optionals. Okay, and then we have the prevention aspects. So when you come to the prevention aspect, I always say try to avoid your allergens. Okay, so try avoiding your first episode of allergen. So once you develop an allergic rhinitis, that will become an infection very easily. So try to avoid your allergic reactions first. So once your allergic reactions are cut down, the next step will not happen. Okay, so prevent your exposure to your dust, pollutants and your pollen grains and all these things. And when you are getting exposed to a microorganism, you can follow all these home remedies. Not everything which is very comfortable for you, you can follow. So definitely this is going to heal your first episode. So once the first episode is stopped, the second episode doesn't happen at all. Okay, so always try to follow the preventive and the home management aspect. So with this we complete sinusitis, where we have discussed about the definition, the causative organism, the etiological factors, the pathophysiology, signs and symptoms, treatment, medical management, home management and the preventive aspects. Okay, so let us discuss another topic with the next class. Till then, take care. Bye.